All right, we will go ahead and get started just to make sure we have time to get through all of our super good content today. Welcome to our Missouri Open Door Benefit Series. This month we are going to be covering SSI and SSDI. This benefit series is sponsored by the Medicare Improvements for Patients and Providers Act, the MIPA grant, priorities 1, 2, and 3. We have Missouri SHIP, which is the State Health Insurance Assistance Program, Missouri Department of Health and Senior Services, and UMKC, Institute for Human Development, which is the coordinator for the No Wrong Door grant. This is just a reminder that Medicare open enrollment is still going on. It is until December 7th. And if you have any questions for the SHIP counselors, their contact is there, and they are always open to help. So just a little overview of the Missouri No Wrong Door. Its goal is to transform the way people access services in the community. It supports individuals and caregivers to make decisions on complete and accurate information about their options for anybody seeking long-term services and supports, regardless of their age, income, or disability. Just to go over our structure of our Open Door series really quickly, we have the integrated support star here to open the door to integrated supports. So our goal is always to make sure that we are focusing on all 5 points of the star and integrating services into an individual's life. We have personal strengths and assets, which are the skills, strengths, and assets that a person has. Relationships, which are the family, friends, or acquaintances that a person has. Eligibility specific, which are going to be needs-based, government, formal services that are going to have a eligibility requirement. So those are the things that we talk about in the benefit series. Then we also have community-based, which are places in the community, groups, membership organizations, local services, and those are all going to be things that anybody has access to. And then we also have technology, which is anywhere from personal and assistive and adaptive technology to environmental technology. And that is covered in our technology series of our mod. So our next benefit series is going to be on December 6th. We changed the date of that one a little bit for the holidays, and that's going to be on benefit enrollment centers. And then our next technology series is next week on November 15th on adaptive gaming. And then December was canceled for the holidays. I will just say really quickly that there is no chat since it's a webinar, but the Q&A is open. You're able to put anything in there during the meeting. We will save questions until the end, but you can put them in there as soon as you have them. And then this will be recorded and posted to our Charting the Life course YouTube and also sent out in an email afterwards. And you will be able to access that after. And then I will go ahead and pass it over to Sandy. Thank you for being here today.
Well, thank you. So I appreciate all of you guys across the state coming in and listening to this. So far we have like 67 participants, which is pretty exciting. Just a little bit about me. I've been working in the field for almost 40 years, and I've worked in day programs. I worked as a vocational rehabilitation counselor for 25 years. And for the last 5 years, I've been a certified benefits practitioner. So certified through Cornell to offer benefits counseling and benefits services to any individual who is receiving that Medicaid and Social Security, Medicare, and helping them understand those benefits. Next slide. So today, I just have 2 objectives for people to understand the difference between Social Security, disability, and supplemental security. And you're going to understand the steps in the process of applications for Social Security. All right, next slide. So we're going to start with what's the difference, supplemental security and Social Security disability. What's the difference and why it matters? So a lot of people say, oh, well, I get SSI or I get SSDI or my kid gets benefits and I'm not really sure. I've never understood the difference. It does make a difference because there's lots of kind of things to consider, like assets, reporting differences if you're working, eligibility criteria, a lot of different things they're different depending on the benefit. And so I'm going to kind of really talk and adjust those and address those today. Okay, next slide. So let's start with supplemental security, SSI. So supplemental security is actually funded through state of Missouri's general revenue. So even though you have to be eligible under Social Security guidelines, the actual money comes from your state coffers. And supplemental security, the very first thing they're looking at is, do you have enough work credits? Do you have enough money in your personal Social Security account based on your wages to, qualify for disability? So supplemental security is meant for those individuals who have very little or no work history. So you're going to find individuals maybe who are children getting supplemental security, or individuals who are very young, 17, 18, 19, 20 years old, who don't have a lot of work history, haven't worked for very long, and don't have enough work credits. Okay, next slide. So what do you consider when we're looking at supplemental security? So a lot of people get a little bit confused. They say, well, my son or daughter had an IEP all throughout school. They needed they had a class within a class. Maybe they had a 504 plan. They really struggle with academics. So the thing to consider when individuals are looking at supplemental security is that it is not looking at an educational situation. Supplemental Social Security is all about work. So you could have an individual who had an IEP all throughout school, but they are able to work, and they're able to hold a full-time job, and they're working. So just having individual education plan, having assistance in the classroom does not necessarily mean that that person is going to be eligible for supplemental security. Remember, Social Security is looking at how that person's disability, how those limitations are impacting their ability to hold a job. Okay, so that's a first big thing to consider. All right, next slide. The next thing that folks are going to need to consider are the tasks on a job, how much the person receives in wages and coaching needs. So individual needs a job coach that, again, does not absolutely connect to say, yes, they're going to qualify for Social Security, but it's a higher likelihood because Social Security is saying, this person has some significant limitations that they need coaching, and they need long-term coaching. They're not going to be able to keep their job or maintain that job without that coach. So that is a piece of what you're looking at. We're going to talk about how wages and how much people earn really impact that Social Security decision. And then they look at tasks. So I mentioned in the last slide that they're not looking at academics. What they do look at is potentially how those tasks in the classroom are going to relate to work. So for instance, if an individual struggles with reading and reading comprehension, they're going to have an IEP that talks about maybe a goal is that they're going to read a one-page document and be able to answer 5 questions with 80% accuracy. Okay, that's going to be an educational goal. But when Social Security looks at that, they're going to say, oh, well, this person may have difficulty understanding written instructions on the job document. Maybe they're not able to understand nuances when they read. It's all very black and white. So hopefully you can understand why they're not looking at an educational diagnosis. They are looking to see how some of those deficits in the classroom are going to relate to work. Okay, so everything about Social Security is about work. They look at, how those deficits are impacting the tasks on the job, how they're impacting their ability to earn wages. Do they need coaching? So whenever someone is looking at Social Security, all 3 of these need to be kept in mind. Okay, next slide. Other things that are really critical to supplemental security. The first thing is assets. So supplemental security is really meant for individuals who have really no money. You can only have $2,000 across all what I call liquid assets, checking, savings, bonds, stocks. They're going to ask that individual for checking account, saving account information. They're going to ask for account numbers. And if that individual applies and they have $2,500 in a checking account, they're going to get kicked out saying they have too many assets. And I've seen that happen. People will get rejected by supplemental security saying you have too much money, you have too many assets. Okay. The second area that they're very concerned in is the shelter. Who is providing housing? If the individual is living with family members, mom, dad, grandma, uncle, and they are just providing that shelter, Social Security says, well, since supplemental security is meant to pay for basic shelter and somebody else is providing that, we're going to take 1/3 of this person's benefit away. So keep in mind, if mom or dad is providing that housing for that individual, this year, instead of getting $914, that individual is going to get $610. Now, there are a couple of ways to that Social Security asks. So for any of the people on this webinar who have worked with folks applying for Social Security or have that for their family members, one of the questions Social Security asks is, are you charging rent? So if you charge rent, then it shows that they are paying for that shelter. Okay. And the other thing that they're going to ask though is, how much is the family, how much is your actual food and shelter? So we're going to take a family of 4, and between their housing cost and utilities, it's $2,000 a month. Well, if this person is paying their share, they would have to pay $500 a month for that shelter. And Social Security said, well, your family's food and shelter, basic shelter and utilities, that's $3,000, and there's only 3 of you in the house. You're going to have to pay almost over $900. Well, Social Security is only $914. So you're like, well, if I charge them, they would have to pay their entire amount. So families are like, nope, nope, we're not going to charge them. And therefore, they lose that third. And one way to address that is for the families to become landlords and charge the individuals rent. Because if you're charging them rent, you're saying, yep, we are doing that, but there's also no reason to charge them more than that third that Social Security is actually going to take away. Social Security is only going to take away a maximum of 1/3 of that person's benefit. So if the family decides they're going to become landlords and they're going to charge the individual for rent, no reason to charge more than 1/3 of that benefit, because that's the maximum they're going to lose if Social Security does take that away. The last thing I want to talk about is income support. When you're looking at things to consider is child support. So if you have an individual who is getting child support as an adult, in some divorce decrees, once that child turns 18, that non-custodial parent is still paying child support. Social Security considers that money received, and that is considered dollar for dollar when an individual is applying for Social Security. I've seen multiple times where the courts have awarded $1,000, $1,200 to the non-custodial parent. Well, considering the maximum amount you can get this year is $914, if that family member is getting $1,000 for that individual with a disability, Social Security isn't going to give that person a cash benefit because the money received is higher than the support given by the state. Okay, so next slide. So what's Social Security disability? So that's a totally different program, a totally different mindset. Anybody can apply for Social Security disability, and you can, but the very first, well, one of the very first things they're looking at is, have you paid enough into the system? So everybody who works, whether they work in the grocery store, they work in a sheltered employment workshop, they work as a doctor, a lawyer, a painter. As we can see, there's a lot of jobs over here in this picture. Everybody pays Social Security tax. It has an account with Social Security. Depending on your age is depending on how many work credits you need in order to qualify for disability. So this year, you only need $1,640 to get a credit for Social Security. Now, if you think about this, that's really not a lot of money. If you work with an individual who's 18 years old and they make $500 a month. They just work a very small part-time job. After 4 months, they're going to have $1,640 in earnings. After a year, they're going to have enough to get 3 credits for the year. There's a maximum of 4 credits available. It does not matter if you make $100,000 or if you make $500 a month. The maximum number of credits that anybody can earn is 4 a year. And when an individual is 22 or younger, or under 23, they only need 6 credits to be eligible for Social Security disability. So you're working with 19, 20, 21-year-olds, let's say 21, 22-year-olds. They got their first job at 18. They've been working at Schnucks, which is a grocery store chain here in St. Louis area. And they make $500, $600, $800 a month. In a year and a half, they're going to have enough work credits to look at disability. And then that disability work credits increases with age. So under 22, you need 6. From 22 to 31 or 23 to 31, you need 12 credits, which is just 3 years worth of work. And it goes up from there. So Social Security Disability Insurance, that's what SSDI stands for. And that means that when you are paying tax from your paycheck, you're paying a tax to the federal government in the unfortunate event that you become disabled and can no longer work. Okay, so you can get Social Security disability at a young age of 18, well, probably 20, 19, 20, 21, well, probably 20 or so. Or you could get it when you're 40. Okay, so it doesn't matter. As soon if you apply for disability, they're going to look to see if you have enough work credits. So if you're working with someone and they've applied for Social Security disability and they get a letter saying you don't have sufficient credits to get disability, that's what this means. They don't have enough work history. Okay, next slide. All right, so we talked about the work history. And we've talked a little bit about the earnings, so I guess I got a little bit ahead of myself. But again, when you're looking at disability, you've got to have some work history. And the next thing they're going to look at is those earnings. All right. So you've got to have enough earnings to get those credits. All right, next slide. So what's not considered when you're looking at Social Security disability? Remember, if you remember a few slides back, I talked about checking or savings, money in the bank. That doesn't matter when you have Social Security disability. So you could have 2 boats, 3 cars, a house on the lake, and $1 million in a 401k. You could still get disability because it has to do with your medical diagnosis and whether or not you're impacted your ability to work, and so on. It has nothing to do with how much money you have in the bank. And so therefore it gets a little confusing for those individuals who started out on SSI, supplemental security, where they were only allowed $2,000. And then their son or daughter transitions to disability and they're like, oh, you can only have $2,000 in the bank. And I'm like, nope, doesn't matter. When you're on disability, assets don't count. It does not matter also where you live. I just went into a fairly long conversation about if you were living at home with your family and they were providing food and shelter to you, then Social Security is going to take a certain, they're going to ask if they're contributing to the household. When you're on Social Security disability doesn't ask who you live with. Do you contribute to the household? You could live with the family, you could live with your parents, you could live with your aunt, you could live with your spouse, but there is nothing that says that you have to contribute to the household. So those are huge differences that oftentimes the folks that I work with, the families are so used to keeping those assets down and worrying about charging their family member rent so that they can get the maximum amount. Those two things no longer count when you have Social Security disability. Okay, next slide. So how do you apply for Social Security? There's a lot of misconceptions. I hear all the time, it is not a guarantee that you're going to get Social Security the first time, but it's also absolutely not a guarantee that you're going to have to reapply. Getting a lawyer is not necessarily something that people have to do. And hopefully I'm gonna go through the steps of what they're looking at, and maybe this will help kind of understand the process. Okay, next slide. So the very first step is they're going to look at income. What we call engaging in substantial gainful activity. And this is true whether it's SSI or SSDI. So if an individual is making this year over $1,470 in a month, then Social Security determines that that is a substantial level of employment, although I'm not too sure how many of us could live on $1,400 and $1,470. That's what Social Security lists as a substantial gainful activity. I just spoke with a family a few weeks ago. Individual has a lot of impairments, needs a lot of support, but this individual is working full time and making $2,500 a month. Well, they're going to get kicked out on that first step. They're making over the substantial level of employment, so therefore they're not even going to go on those further steps. Okay. Number 2, next slide. So number 2 and 3, the claimant have severe limitations. All right. So I want to review that limitations are not diagnoses. And this is kind of a critical point that many of you potentially have seen. There is a young model who has diagnosis of Down syndrome, and she's been on runways, and she's been on covers of magazines. She's been on television. And she does have a diagnosis of Down syndrome, and we've seen in the media, they tout how, she has Down syndrome, and look at her, she's making this fabulous life and very mainstreamed. Well, I would venture to say that because of the Down syndrome diagnosis, there are probably deficits in some academic skills like reading and writing, potentially arithmetic, and maybe some other deficits. But is her disability limiting her ability to go to work? No. She's earning nice living. So there's, some limitations, but they're not severe limitations that are impacting her ability to earn a living. Okay. So that's step number 2. Step number 3, is that diagnosis on the list of Social Security's list of impairments? So Social Security has a list, 250, 300 different diagnoses. Next slide. So they look at residual functioning. And this is a little bit harder to kind of grasp, but what they look at is, and I'll take an individual with maybe a potentially like for a spinal cord injury. So this individual was an accountant, and they, heaven forbid, got into an accident and now have a spinal cord injury. Well, are they still able to do their accounting skill? Most likely, yes. So the residual functioning, those work skills are still there. They can still do books. Maybe they might need some adaptive equipment if they've had some other limited motion, but the basic skills of accounting were not impacted. So while they do have some deficits, the residual functioning is still there. They're still able to do the job. In that situation, the person may not be up for Social Security. If a person has a very physical job, Let's say they were a roofer and they fell off the roof or had a spinal cord injury. Well, most people are not going, and you're not going to be able to get on a and be a roofer from a wheelchair. So they're in that situation, that residual functioning, maybe they do have other skills, but that residual functioning in that field, they don't really have any because they can't really continue to do that kind of work. And then they look at those workplace skills. So they look at where the individual, what skills they have, what functioning they have, and what is the workplace employment opportunities for those skills. So if the individual has, let's say they worked in tool and die, and it's not a huge amount of jobs in that area potentially, and maybe they still have some of that residual functioning, but there's not jobs, there's not workplace employment for that individual. That's going to make a difference in that, in that decision. So steps 4 and 5 are a lot more interpretive than the first 3 steps. And when you're looking at Social Security, of course, you're looking at, does this person have a disability that's going to last over 12 months or result in death? If someone has other kinds of disabilities that are short term, let's say, for instance, someone who's in a car accident and they had a lot of damage. They broke both legs and they going to be in the hospital for potentially a month and in rehab for 3 months, and then a lot of physical therapy on an outpatient basis, and it may take 9 or 10 months before they're ready to go back. No one really has a picture of what residual abilities they're going to have. But Social Security probably isn't going to say, oh, we're going to give someone like that Social Security, because we're not really sure that's going to last those 12 months. And we don't know what those, residual functioning and those workplace skills are. So something like a spinal cord injury, a head injury, those are a little bit more concrete, as it were. And those are definitely going to last more than 12 months. But that's why people, say, oh, I got to apply for Social Security. My doctor told me to apply for Social Security. And sometimes that isn't really the best advice because they're not meeting some of these criterion. Okay, next slide. So let's talk a little bit about Social Security and healthcare. So when someone has supplemental security, SSI, in Missouri, they automatically qualify for Medicaid. But in Missouri, you still have to apply for Medicaid. But you automatically are going to qualify because Medicaid in Missouri says, oh, well, if the federal government has already determined that you're disabled, then we don't have to worry. We don't have to verify that you're disabled. We just need to verify, you just need to apply. In some states, the two kind of come together and people don't have to apply, but in Missouri, you do. And in Missouri, the Medicaid office does get a regular printout, a regular access, I guess, to the Social Security system, and they can see when people are actually getting SSI or when people's SSI is stopped. Had an incident here a few months ago. An individual had too much resources. They stopped their SSI. Medicaid wrote the family and said, this person's SSI has stopped. Need to either provide proof that the SSI has started up again, or this person needs to apply because they didn't have the proof anymore. So Social Security disability insurance, they might be eligible for Medicaid, but remember earlier on in the talk that I talked about how there is no asset limit, and there is no, it doesn't matter where you live. You know, you could have 2 houses or whatever. So when you have Social Security disability, if you meet the asset limit, which currently in Missouri is $5,700, I think, and like $35. I just rounded out to 5,700. It's pretty easy way. Then they might be eligible for Medicaid for people with disabilities if they have low assets. They might be eligible for Medicaid expansion if their Social Security disability is low enough. And again, you know, looking at those asset pieces. Medicare, in order to get Social Security disability, you have to receive Social Security disability for 2 years, or 24 months, and then the 25th month, you're eligible for Medicare. Okay, next slide. How does working impact people's benefits? So working impacts Medicaid. It can impact, it's really not going to impact Medicare too much, but it definitely is going to impact SSI and Social Security disability. Next slide. So let's talk about a little bit about reporting your wages for supplemental security. After the first, so after $85 exclusion. So what that means is the first $85 that somebody earns on the job, supplemental security doesn't count. Then for every $2 they earn, supplemental security subtracts $1 from their cash benefit. So let's just say a person earned $500. They're going to get, after $85, now Social Security says you only made $415 because that $85 exclusion, and you divide 415 by 2. So they're only going to take they're only going to count $207 of that $500 wages. And what they'll do is they'll subtract those wages from the amount of Social Security. So in my example here, if someone earned $1,000 on the job, they would lose $457 in their cash benefit. And what Social Security would do is they would subtract 457 from the amount of SSI that they're getting. It's hard to understand and hard to visualize when I'm just talking, but it's a pretty easy formula to kind of work through. So Social Security disability insurance has a very, very long program to help people try to go to work without jeopardizing their connection to Social Security. This presentation is really not long enough to go into all the specifics. If you would want specific information and a better understanding of the disability insurance, SSDI work programs, I would encourage you to kind of reach out and kind of ask some of those questions through email or by phone. We just don't have time to really kind of go into it here. All right, next slide. I noticed there's about 7 questions in the Q&A. So I'm just kind of going to go down through them, Angelina, if that works okay. Okay, so what if someone was living in housing with a family member, but then they move out of that situation and now have to pay their own housing? How does that change that information with SSI, or will it always be taken away? Okay, great answer. I mean, great question. So if they are now living on their own and paying their own shelter, then their SSI moves up to the full amount. So this year, if they were living with the family and not paying for shelter, they would get 610, but when they moved into their own apartment, or maybe into a supported living situation, you would notify Social Security, and Social Security would change their SSI to reflect that they are paying for their own shelter, and they would give them the whole 914. How many credits did you save 23 to 31? They need 12 credits in order to qualify for Social Security between age 23 and 31. So if someone was age 22 and they had 6 credits, and then they are continuing to work, as soon as they have an additional 6 credits, which could be only a year and a half more, then they would apply. They don't have to wait until age 31. It's just any time between that 23 and 31 age group that they would need 12 credits. I don't think I made that clear earlier. What if someone can complete the task of being an accountant that can no longer shower or drive, so they cannot get to work or may not be acceptable for work, so they lose their job? Okay, so being able to drive is not going to be enough to result in them getting Social Security. The showering piece, again, probably is not going to be enough to not to get them Social Security. They can hire somebody to help them with personal hygiene. They could potentially work from home. So they look at all of those factors. Vocational rehabilitation is looking at how does those work limitations. So even Voc Rehab isn't going to look at that. They're going to look at what kind of supports maybe can we help this person get so that they can shower, so that they can get to work. But it's all about work. Is the list of acceptabilities available for service coordinators? If you go over to Social Security online, there is a list. I think it is available online. It's a list of all the diagnoses. Do some children qualify for Social Security? So yeah, I mentioned early on. So SSI, a child could potentially be eligible for SSI, but it's going to be dependent on a couple of things. The criterion for children is obviously not about work, because we don't expect our children to work. They do look at, I think, significant level of impairment, whether somebody is going to kind of need to, help that child, be around that child. But supplemental security for children is also largely based on the income of the household. So, and if the household's income changes, then their SSI is going to change. So it could literally change from month to month. SSI is available to children, but they have to be pretty significantly impaired. Are they looking at wages before or after taxes? They're looking at wages before taxes. And they also, sometimes during that process when they're looking at wages, if there are supports, potentially if they do have a job coach, or they do have other supports, maybe they have less job responsibilities and things like that, there may, Social Security will look into that if they have that documentation when they apply. I've had individuals who've had job coaches, and then they present that information to Social Security showing that they need more supports, and those wages are kind of a little bit higher than what they appear to be. Made a statement a few slides toward the end that you would not qualify for SSI. Can you explain again, please. Okay, I need a little bit more. Whoever that is, could you do a little bit more quantifying, because I'm not sure which slide you're talking about. Okay, so an individual in a natural home cannot find work. Voc Rehab cannot assist with finding work, wants to move out, denied SSI. Words of SSI. I think that person didn't finish their typing. So also that individual, if you want to raise your hand or type out an additional question, because I'm not
I
clear
think
on
that
what.
I think that next one of words of advice was the next one. So I think they were just looking at if you have any advice for them being denied SSI with
Oh,
those.
okay.
Yes,
With those particular things. Okay.
correct.
So, so I think the key piece, it would be why they were denied SSI. If Voc Rehab has said that they're not ready for employment, that they're not, that they can't benefit from employment, that kind of sends to me that their disability is impacting their ability to work. So it could be they have too many assets. It could be that they're applying for disability and not SSI. I think that I would need more information as to why they are denied SSI before I could really answer that. But if someone's already gone through Voc Rehab and Voc Rehab has said that the person is not employable at this point in time, then that should hold a lot of getting those records from Voc Rehab and appealing the decision. Now, if Voc Rehab says you're not able to go to work because you don't have childcare, that's different than you're not able to go to work because you don't have, you can't stay on task, or, so I guess it would really kind of add to my, answer. Depends on why Voc Rehab said you can't go find work. Is it because you don't have transportation? That's a little different than, you don't have the skills or you don't have the attention or whatever as to why they're saying that you can't go to work right now, why you're being denied. Okay. Any other questions? Do you set appointments to answer questions individually? How does one do that? Yes, I do. My contact information is at the very last. Oh, there it is. My contact information is there. You can email me. You can call. I do offer in-person and virtual appointments as well.
All right. Looks like that's it for our, oh, we just got another question, but we are
Receive
at
information on
time.
how you be certified as a benefits counselor. So if you go to Cornell, their Yang Tang Institute, that is Cornell's program on that they train individuals to be certified as a benefits practitioner. It's about 1,600, I think, and it's about a 4-month course, I believe. If you are working with an agency that partner DMH, Department of Mental Health, they are interested in getting more certified benefits practitioners around the state, and they will pay a small portion of that funding. Otherwise, it's about $1,600, and it's 4 hours a week, intensive through virtual, 4 hours a week of webinars, and then you probably spend about 4 hours each week in reading the material and doing some homework assignments that they give. And then there is a master test at the end of the certification that you have to pass. It's about I can't even remember how many questions. And then you're also required to do a case study. So it's a pretty intensive training, but very helpful in this field. Okay, I think I
Oh,
finally answered all the questions.
yes. All right. Thank you everybody for being here today. And thank you so much, Sandy, for presenting. As I mentioned earlier, this recording will be posted to the Charting the Life course YouTube. You can watch it there, and then the link to that, as well as a PDF of these slides, will be sent out to everybody that registered. And thank you all. We will see you on December 6th to talk about benefit enrollment centers.
All right. Thank you for inviting me, and I look forward to hearing more topics.